discuss whether it's a good idea to come to the Philippines if you have serious health problems. Southeast Asia's cost, pleasant climate, vibrant culture, and well established expat networks are the primary reasons that older expats choose to retire here. Yet, this decision must be carefully considered due to potential health difficulties. Older expats, particularly those with serious health difficulties, must weigh the region's numerous advantages against potential barriers to getting and paying for treatment. In this vlog, we will examine the variables that lead people to retire in Southeast Asia despite health concerns and evaluates the decision's overall wisdom. There are numerous reasons why retirees choose Southeast Asia, the main one being the region's lower cost of living. Thailand, Vietnam, the Philippines, and Cambodia have far lower living costs than Western nations. For example, a $1,000 monthly budget can buy a comfortable life in Phnom Penh, Cambodia, where rent can be as little as a few $100s. This financial benefit allows retirees to live more comfortably on a fixed income and stretch their funds further. Another major draw to the area is its nice climate, particularly for those wishing to escape the colder months. Thailand, for example, is a popular location for travelers looking to escape the harsh winters due to its excellent weather all year. The climate promotes an active lifestyle by providing opportunities for outdoor leisure and enjoyment of the area's natural beauty. Southeast Asia's many cultures provide retirees an engaging environment. The region provides a variety of living experiences and is known for its historic cities, tranquil natural scenery, and unique customs. Moving to a new country and going through cultural shock is an exciting way for many expats to begin a new chapter in their lives. This cultural immersion can help to enhance retirement by encouraging personal development and a sense of adventure. Another key factor is the presence of well established expat communities in Southeast Asia. These communities provide newcomers with a network of support, allowing them to cope with the challenges of living abroad and adjusting to a new environment. These clubs provide social events, shared interests, and a sense of community, all of which can help reduce loneliness and homesickness. Regardless of the attractiveness, older expats with serious medical issues should carefully consider Southeast Asia's healthcare system. Although most of the region's countries have world class private hospitals, access to high quality healthcare varies and cost can be a concern. Numerous Southeast Asian countries have invested in cutting edge private hospitals that serve both locals and expats. These clinics frequently employ internationally qualified professionals, English speaking personnel, and cutting edge medical technology. Private healthcare is expensive, and medical expenses might be considerable if you do not have enough insurance. Southeast Asia also has public healthcare systems, although they may not offer the same amenities or levels of care as private hospitals. Public hospitals may be less expensive, but they may also have longer waiting times, outdated technology, and language barriers that make communication difficult. Although this is less of an issue in tourist places, there are times when English is not widely spoken, which can lead to communication difficulties. In Southeast Asia, health insurance is an important consideration for retirees. Even though certain countries, such as Thailand, requires health insurance as part of the requirements for retirement visas, the minimum coverage may be insufficient for people with serious health concerns. Though premiums may be pricey, particularly for senior citizens, comprehensive overseas health insurance plans can provide access to private facilities and a broader range of medical treatments. Health insurance costs often rise with age, and some insurance may exclude or refuse coverage for pre existing conditions. Prior to retiring in Southeast Asia, older expats should obtain enough health insurance coverage and plan for potential premium increases as they age. Although there are trade offs, options such as higher deductibles or inpatient only coverage can help lower costs. There are some potential risks and obstacles when retiring in Southeast Asia with serious health conditions. As one ages, it becomes increasingly difficult to obtain decent, fairly cost health insurance from private insurers. Many insurers limit the options accessible to those over 65 by capping insurance eligibility at a certain age. Pre-existing medical conditions may also result in exclusions from coverage, higher premiums, or outright denial of coverage. In the event of a catastrophic illness or accident, it is not always possible to seek treatment from one's home country's national health system. It can take days or weeks to transport someone with catastrophic injuries or a life threatening condition, and there will be significant unexpected expenses. A medical move can be exceedingly expensive, especially if extensive care and equipment are required. Navigating healthcare systems in a foreign language can be difficult, potentially affecting the quality of service. Communication barriers might arise at public hospitals where English is not widely spoken, making it difficult to understand treatment options and medical advice. Even though staff members at private hospitals typically speak English, knowing a few basic phrases in the local language can help improve communication and ensure quality treatment. Lifestyle changes, such as conforming to local environmental and dietary standards, can have an impact on one's health. Foreign food can be much more expensive than local food, and local cuisine may differ significantly from what you are accustomed to. Air pollution can exacerbate respiratory illnesses, particularly in certain areas during the burning season. To protect your health, you must be aware of these dangers and take proper precautions. Depending on their specific tastes and circumstances, older expats with serious health issues may find that retiring in Southeast Asia is a viable alternative. Making an informed decision involves thorough preparation, extensive research, and realistic expectations. Retiring in Southeast Asia can be rewarding for those with manageable health conditions and adequate financial resources. While the rich culture and mild climate may boost overall well being, the lower cost of living can also ease financial stress. Having comprehensive insurance and access to high quality private health care can provide peace of mind. To limit risk, it is critical to identify potential impediments and adopt preventative measures. On the other hand, retirement in Southeast Asia may not be a suitable decision for people who have major or unstable health concerns and a limited income. The benefits of a lower cost of living may be offset by the likelihood of high medical bills, limited access to specialized care, and communication challenges. In these cases, it may be advisable to consider alternative retirement places with stronger and more affordable healthcare systems. If Southeast Asia is not a good fit, there are several other countries that provide excellent healthcare systems and appealing retirement options. For older expats with health concerns, these solutions may provide a better balance of convenience, cost, and care quality. For example, the World Health Organization rated Colombia's healthcare system as superior to that of the United States. Many medical experts in the country have undergone training in the United States or Europe, and there are a variety of public and private healthcare options accessible. It is an appealing option for anyone looking for affordable healthcare because medical treatments are far less expensive there than in the United States. France, too, has universal coverage and a highly valued healthcare system. French nationals can receive reimbursements for prescription pharmaceuticals and medical services, as well as use the country's insurance scheme, Sécurité Sociale. Furthermore, the French healthcare system covers long term illnesses completely, providing financial security to people suffering from chronic diseases. Spain has one of the best healthcare systems in the world, which is incredible. The country offers both public and private healthcare, and foreign nationals who apply for a retirement visa must have private health insurance. You can change their private insurance to a supplemental plan or opt to join in the public system for free after a set period of time. Costa Rica is known for its high level of life and affordable healthcare. Citizens and legal residents have access to universal healthcare through the Caja Costarricense de Seguro Social, the country's healthcare system. To maintain their legal status, expats must join the Caja, which typically costs 14% to 16% of their reported monthly income. The World Health Organization ranks Portugal's healthcare system among the best in the world. The country has three health insurance systems, specialized programs for specific professions, voluntary private insurance, and the Servicio Nacional de Saúde. You can gain access to the Servicio Nacional de Saúde by enrolling at their local health center and paying nominal user fees. When deciding to retire in Southeast Asia, older expats with serious health difficulties should consider a variety of factors. It is recommended that they consult a financial expert to establish whether their medical bills and insurance premiums are affordable. Working with an expert foreign health insurance broker might make it easier to find coverage that meets their specific needs and budget. It is critical to speak with a healthcare practitioner about the quality and availability of care for any pre existing conditions. Research in the local healthcare system is critical. This involves determining how close hospitals and specialists are, as well as whether any medical staff speak English. Learning a few basic phrases in the local language can improve the whole healthcare experience and facilitate communication. Making contact with other expats in Southeast Asia may provide valuable information and assistance. In addition to recommended physicians and medical facilities, expats can share their experiences with the healthcare system and offer advice on how to overcome the challenges of living abroad. Participating in expat forums and social organizations can help you develop a support network and reduce feelings of loneliness. It may be beneficial to consider a trial period before committing to a long term change. Examining Southeast Asia for a few months can help establish whether the environment, healthcare system, and manner of life are appropriate. This trial period can provide valuable information and help you make a more educated decision about retiring in Southeast Asia. The decision to retire in Southeast Asia despite serious health issues is ultimately a personal one. It is critical to weigh the challenges of healthcare availability and costs against the benefits of affordability, climate, and culture. With careful planning, extensive research, and realistic expectations, you can have a comfortable and fulfilling retirement. For older expats seeking affordability, a good climate, a dynamic culture, and established expat networks, retiring to Southeast Asia may be an attractive option. However, for people with severe health conditions, the decision must be made carefully, taking into account the expenses, accessibility, and challenges of healthcare. Even though the area has excellent private hospitals and a thriving medical tourism industry, it is critical to have enough health insurance, learn about the local healthcare system, and plan for any necessary lifestyle modifications. For some people, the benefits of retiring in Southeast Asia outweighs the risk, but others may want to retire somewhere with stronger and more cheaply priced healthcare systems. In the end, thorough planning and a realistic assessment of one's individual needs and circumstances are required for a successful retirement in Southeast Asia. All right, folks, that is all for today's show. If you have any questions or comments, please comment down below. Thank you all for watching. Until next time, have a good day.